this won't hurt and it'll be over in just a moment.
Uh-huh. What's that?
Conductant.
A little dab will do you. Right, Mr. Jackson? Well,
They know that's a lie. If you actually, now today, because we've got a lot of research now since they floated this in the 70s. If you call up a researcher from Eli Lilly, and let's say you're a journalist and do this, they will start out with that story. They'll say, oh, well, it's like insulin for diabetes, it corrects an imbalance. And you'll say, well, no, it doesn't. It blocks, you've done your research of what's sent to the FDA, and you'll say, no, it blocks these neurotransmitters profoundly. That's not balancing anything. And they say, oh, well, that's true. So the guys at Eli Lilly will back away from that in 2 seconds. And they'll say to the Eli Lilly guy, what's the evidence for it? And the Eli Lilly guy will be honest, we don't have it. By the time of 79, 80, and they've investigated it, they have reason to think that story is not very accurate. By 92, they know it's not accurate. And that's the moment it moves from maybe a flimsy hypothesis to, when they keep on saying it, where it's fraud because they know it's not really true. Well, the question is what researchers know among themselves in terms of what the drugs do. So you go to the Zyprexa.com website and it says Zyprexa fixes a chemical imbalance, okay? So that's one story out there. But now I go to Science magazine, okay, which is a story that they're telling among themselves, and Science journalist says, what causes schizophrenia? And they respond, we don't have the slightest idea. That's January 17th, 2003. So I think the precise thing is the mechanisms are totally unknown. And I asked a guy from Janssen, which makes risperidone, why do you make these statements? It's like insulin for diabetes. He says, well, it gets people to take their drugs. It's a story that they can understand. That's what they tell you. And I said, so it's not real? They said, no, of course not. We know it's much more complicated, et cetera. But it's a way to get people to take their drugs.
Cymbalta can help. Cymbalta is a prescription medication that treats many symptoms of depression. Tell your doctor right away if your depression worsens, you have unusual changes in behavior, or thoughts of suicide. Antidepressants can increase these in children, teens, and young adults. Cymbalta is not approved for children under 18. People taking MAOIs or thiridazine or with uncontrolled glaucoma should not take Cymbalta. Taking it with NSAID pain relievers, aspirin, or blood thinners may increase bleeding risk. Severe liver problems, some fatal, were reported. Signs include abdominal pain and yellowing of the skin or eyes. Talk with your doctor about your medicines, including those for migraine, or if you have high fever, confusion, and stiff muscles, to address a possible life-threatening condition. Tell your doctor about alcohol use, liver disease, and before you reduce or stop taking Cymbalta. Dizziness or fainting may occur upon standing. Side effects include nausea, dry mouth, and constipation. Ask your doctor about Cymbalta. Depression hurts. Cymbalta can help.